So just so you know, I do operate. I do this kind of stuff on my late afternoons and on my non-surgical afternoons where I inject. So, but I am in the OR the rest of the time. So disclosures, I pretty much work with almost all the companies, so I try to keep it equal. You know, the way I kind of designed this talk is I kind of want to pick a couple of technologies and talk about these technologies rather than run through everything that's on the planet, because that will take me more than 30 minutes. So these are the kind of things you plug in a wall that are useful for plastic surgeons for, you know, for 2017. And, you know, a lot of this is borne out by data that's hard data. This is from ASAB's data. Every year since 1997, they put this data out. And if you look at it, of the top 10 aesthetic procedures, 4 of them are device-related. So, you know, really, when you see these kind of numbers, you know, it's important that we teach our residents about these things, because when they get into practice, the patients are going to be asking them about these things, and you guys need to know about these things. So 4 out of the top 10 warrants our attention. So how do you start? Well, if you really talk to anybody who really likes this kind of stuff, we kind of break it up into things that are really important and that you're going to use, and door stops. You know, because the last thing you want to do is spend $100 on something that's going to sit in a corner and not be used. So most of us kind of look at this and say, you know, the IPL devices, and if I say broadband light, one of the companies, Cyton, calls their IPL BBL, so it gets a little confusing. It's a marketing term. So really, I like to start with that. Laser hair removal, I think, depends on where you live. You know, in California, a lot of times you have these cheapo clinics, so it's kind of important to know about it, but it's really boring for us to talk about this kind of stuff. And I think every plastic surgeon needs to learn how to resurface. I'm going to go through that. Clearly, the first thing you should buy is an IPL device. You do a lot of stuff with it, vascular and pigment. You're talking about light in the visible spectrum up to the early infrared spectrum. There are different filters that you can use with some of the devices and different handpieces that you use from other companies, and this determines kind of the light spectrum that you see. And what do you do with this? Basically, reds and browns are the easy thing. This is just BBL, another patient after BBL, IPL on the face. This is what you can expect after a couple of treatments, usually a month apart. Décolletés, we all do a lot of breast surgery, so after you do your breast surgery, it's nice to clean up the décolletés. And if you look at some of the texture changes that you can see before and after here, you definitely get some texture improvement with these light devices. Don't forget about hands, you know, very important. You know, Bill does a lot of faces, you know, and the patients have beautiful faces and lousy looking hands. So you want to try to rejuvenate them with injectables and lasers for color. So it's definitely important. And I do a lot of scars. We all create a lot of scars. So anything red in my practice gets IPL'd, and anything raised in my practice gets fractionaled. And there's a lot of data on fractional I'm going to talk about a little bit for scar therapy. Hair removal on light-skinned patients with dark hair is sort of the way to go with this. You can't treat darker-skinned patients or tan patients. But, you know, if you're looking at the whole hair removal spectrum, there's lots of stuff out there. I think that if you're really going to get into this, Alex's are the best, but when you're looking at darker-skinned patients, you need to use your ND-YAG laser or 1064, lower settings, multiple sessions. This is a case that Tony Wolf sent me, did a big rotation flap for a big skin cancer, and after that, we took care of some of the hair, so kind of a mix between the reconstructive and the cosmetic side of things. But with the same ND-YAG or 1064 lasers, we do veins. So big honker on the lip, that's a big vascular malformation. That's 2 treatments, and you can see that if you were going to cut that out, you'd have a big scar through the vermilion and possibly wouldn't get the feeding vessels. So that's just really easy to do. And I do a lot of dark circles under the eyes, which are primarily caused in lighter skinned patients by increased vasculature, big veins coming in. So when you kill these big veins in these lighter skinned patients, the eyes lighten up. So I do quite a bit of that in my practice. But that's kind of like the boring stuff to talk about. I really love talking about skin resurfacing. You know, and Jeff and I have been in this resurfacing business for a long time. Back in the day when we had our old full field CO2 devices, it was on or off. These were your settings. You're going to burn the patient. It's going to take them 3 weeks to recover. They were going to be miserable for months, and they wouldn't tell their friends about it. The newer lasers are a rheostat. We can go from no downtime to significant downtime depending on your settings and your different devices. So 2 terms, full field, fractional. Full field is old school, like a dermabrasion or a chemical peel. You're taking off 100% of the skin surface area. You're healing from the bottom up, from your hair follicles and your sebaceous glands. This is full field, okay? As opposed to fractional. Fractional, you're treating an array of injury, and it's either non-ablative fractional or ablative fractional. So it's an array of injury. You heal from the bottom, you heal from the sides. Non-ablative causes a column of dead skin. That's the histology. Everybody see the dead skin in the middle. And then ablative basically chops a hole in your skin. So this is ablative, and that's the difference in histology. Very easy to understand between non-ablative and ablative histology. We all started with non-ablative, we kind of moved to ablative. The newest thing that I've been using, and Jeff and I were just chatting about this, is a hybrid laser. So it's a combination of ablative and non-ablative in the same hole. The question is why? And the answer is better results. We're seeing better results than we ever saw with non-ablative. And believe it or not, I mean, surgeon, I think, chop a big hole, you'll get a good result. But we're getting a better result with these hybrid technologies than we ever did with the ablative technology. Here's what the histology looks like. You get some coagulation in the dermis, and then you get a little bit of superficial ablation in the epidermis. And here's a comparison of the three histologies out there between non-ablative, ablative, and the hybrid technology. So the question is, now that we have these full field and fractional devices, what do you do? I mean, we have basically a lot of this is built in one platform in our practice, but how do you decide between one technology and another technology? Well, it's clear, like, I don't like to read my slides, but how bad do you look? If someone has deep wrinkles, they're not really going to get away with a minimal invasive technology in 2017. By the same token, if someone has very little pathology, you're not going to cook them. Okay, so you really look at what we do, and also, if they're in the OR getting a face or a tummy, basically we have the opportunity that the patient has a little bit more downtime. So if I see someone like this, I look at her and I go, well, you know what, you can dermabrate her, you can peel her, and maybe if you peel her deep, you may get some hypopigmentation. I can't fill her, because if I fill her, she's just going to look like she got punched in the mouth and going to have a fat upper lip. But to me, this is all day long full field erbium resurfacing. That's a 6-year post. I can do this consistently, and I can teach anyone here to do this in probably 10 minutes, okay, without getting hypopigmentation and without getting really prolonged healing. That's the new technology that we're dealing with in 2017 that's different than what we used in the past. If I see someone like this, I have a lot of options, and these are from a study that we did. So I would use a hybrid technology on her now because the healing is faster, she doesn't have a lot of pathology, and she'll be very happy that she can wear makeup in 1 to 2 days and look good within 48 hours. And that's what you look like at day 1 with hybrid, and no matter what settings you use, it's really crazy, you're healed by day 5 or day 6. And you look, most of the patients have makeup on at 48 hours. This is a new research interest that I have. It's called the VivoSight technology. It's optical coherence tomography, and it's used to measure skin. It looks at the first millimeter of your skin using a mid-infrared laser. Pretty cool. So that's that wrinkle in that lady, okay? And I looked at it, and then I looked at her and said, wow, that's pretty deep. But now you can actually measure it. You know, that's 230 microns deep, or 0.2 of a millimeter deep. That's a pretty damn deep wrinkle on her skin, isn't it? It's pretty cool. And you can also see the reticular dermis, and you can see the vasculature that's sitting in her reticular dermis. That's after halo. So that's a picture of halo with the dynamic scan and the structural scan, and you can see all the blood vessels. So now we're kind of using this data to kind of treat different things, such as redness with it. So that's a nasal vein in a guy's nose. I actually treated him with a ND-YAG laser, but you can see that's what the vein looks like, and you can see the depth of the vein, okay? And this is really cool. Look at the 3D reconstruction that they did of this nasal vein. Okay? So it looks at the first millimeter of the skin. So we're starting to look at applications for this technology. And in fact, in Europe, it's approved for non-melanoma skin cancer. So you can image a skin cancer, and then perhaps you can laser that skin cancer or treat it in any other way. So it's pretty cool. We're kind of using this to kind of aid our laser treatments in terms of depth and densities and things like that. So in terms of the full field non-fractional resurfacing, like the lady I showed you with the deep wrinkles around her mouth, okay, I use this for eyelids. This is 8 years out after just resurfacing to her lower eyelids. So it takes a lot for me to do a skin muscle flap on the lower eyelids. The most I'll pretty much do is a pinch, and I'll definitely do transconj, just like in this lady, and she's 8 years out of a transconj, bleph, and laser resurfacing. So the results persist, you tighten up really nicely, and this is what my preferred use of a therapy for lower eyelids is. Perioral, I do this all day long. Okay? Most of the time I do these now, deep resurfacing. If they're not getting a facelift, I do it under local anesthesia. Patients get a Valium, they get a shot of Demerol or a Percocet. I block their face, I put shields in, and I laser them. I used to do these all under IV sedation or general anesthesia, and I've switched almost 100% to local nowadays, and the patients are way happier. So that's 80-year-old lady, okay, again, laser resurfacing a year out. This is a lady, I did her forehead and whole face. Interestingly, that her brow came up. I didn't do a brow lift on her. Okay, and that's her full face a year out. So I do a lot of this in the practice and tightened up her eyes. The healing times are not what you would expect. It's way less than you used to see with CO2. This is a 2-week out and about as deep as I go, and there she is a couple of months later. But they're not as maroon or deep red as they used to be with CO2. So the patients, these deeper cases, have makeup on after about 10 days, and they're way happier than the ones we did 20 years ago when they were miserable for weeks and weeks at a time. So I do a lot of faces with lasers. That's just an early result, but I kind of just showed you that I don't do the neck. I don't laser the neck when I laser the face. I do deep on the forehead, eyes, and mouth, and pretty much a little bit in the cheek. And under the flap, I just do a little fractional treatment on the flap. I do a en bloc sort of smash platysma. I don't do a lot of cheek undermining these days. I do a lot more fat grafting and lasering to kind of work on the cheeks. I close with quills, and I do tumescent, so it's really clean. I don't really see a lot of blood. I haven't had any increase in any flap loss with the lasers. I've probably done a couple of hundred cases by now, so it's definitely a good adjunct to your laser cases. So that's our eyelids. Brow came up. That's another one. This is my favorite case. Facelift, fat grafting laser, obviously facelift for repositioning, fat grafting for the cheeks, and the laser for cleaning up the skin. So it's definitely something that you can add to your practice. You have to modify your techniques a little bit. If you're a thin cheek facelift flat person, I might not do as aggressive as I do. Okay, there she is. There's a lot of data now on scars with ablative fractional lasers. This is from a buddy of mine who's a Mohs surgeon in Denver, Joel Cohen. He lasered this patient twice, and you can see, interestingly, after his flap, basically the scars almost disappear on the face. So we do quite a bit of this on our surgical scars. This is a lady that came in to me. She was 80 years old, on Coumadin, a lot of medical problems, had a previous deformation of her nose from big cancer, and I just did a little fractional treatment on her that took like 5 minutes. And you wait a while, it's like watching grass grow, but they did rechange. He kind of reformed her face a little bit. So definitely something that you all should be having an interest in, because scars treatment has really become big business now. So a little kind of pictures on the hybrid that I showed you. This is one treatment with the hybrid fractional. Remember, this is about 1 day downtime. And in my experience with lasers, I've not seen anything with these kind of results with this limited amount of downtime. And this is the same platform laser that I use for the deeper erbium resurfacing. That's a Vizia picture showing UV damage. So actually, you can see his UV damage really decreased. Okay, pretty good results. Asian patients. The problem with lasers with Asian patients is they get PIH, or post-inflammatory hyperpigmentation. So with this, we're seeing really, really good results on our Asian patients, keeping the settings and the densities a little bit on the lower side. And there's a UV photo showing the amount of UV damage that's decreased. So that was step one. Okay, a little bit of IPL. A lot of resurfacing, because I think every plastic surgeon should be doing resurfacing. Now kind of getting into, for the next 15 minutes, kind of step two, which is a little confusing because you have a lot of options to choose from. But I'm going to try to narrow that down. Let's start with non-invasive body contouring. These are the devices that are out there on the market that we use for non-surgical fat removal. Cryolipolysis, which is cool sculpting. Ultrasound-based, which is both Syneron, the UltraShape device, and the Salta device, which is part of Valiant, that's liposonics. Cynosure on sculpture, that's a laser. Vanquish is made by BTL, that's a full field radio frequency device. And of course, everybody should have Kybella in their practice because that's owned by Allergan. It's easy to squirt a little bit in your face and some other off-label areas. So cryolipolysis, the interesting, if you've never heard of it by now, it's kind of strange, but it came about because Rox Anderson and Dieter Mancine, derms from Harvard Labs, they found there were 2 cases in the literature. One was popsicle paniculitis, meaning a child sucking on a popsicle lost facial fat. And 2 was a woman riding horseback in England lost some thigh fat because of the chill. So they reasoned that there was some relationship between cold and fat loss, and they developed this device, which has been out since 2010. It's a device that suctions the fat between these 2 metal plates. It chills it to just above freezing, and some of the fat dies. Jake Burns did a nice study on this. It showed 22% of the fat in that area died. And here's the histology. You kind of get this programmed cell death over a couple of weeks, and by 90 days, the skin looks normal, the fat looks normal, it's just less fat there. There's no impact to serum, lipid, and liver functions. And this is what the FDA had a big problem with initially with any of these non-surgical fat removal devices. But basically, they got over it because there were no changes. And Jeff's lab at UT did some of the initial work with UltraShape with a lot of the serum lipid levels, and they showed that there was no change in serum lipid levels after treatment with the UltraShape. So the results of cryolipolysis are really durable. It's FDA cleared for these areas. So that's what the device looks like. Has an applicator. There's a gel pad that protects the skin. It goes on. It's really comfortable. I've had this done to myself. There's a bunch of different applicators. Within the last year, they came out with this new applicators that reduce the treatment time from an hour to 35 minutes. So that's the fastest treatment time. It actually works pretty good. There's no change. You do flanks with it, abdomens, okay, abdomen. So it works really well. Thighs, chest. You can do gynecomastia. That's Grant's picture. Thank you, Grant. There's a Cool Sculpting Mini that's used for the bulges. This is just showing you what your neck looks like with that. MRI result. So it really works well. This is Cool Sculpting. Okay. Now, I still think, I'm going to say this again, I still think that the Cool Sculpting device is the best non-surgical fat removal device out there at this time. But these are some of the other devices. UltraShape, and Jeff did a lot of the early studies with this. It's the VD, kind of the variable focus one. There's a new one is out now that's called the Power that I don't have any experience with. So this is a focused ultrasound device. It's focusing the ultrasound in different layers. And this is sort of some fat. You can see what the difference between the original, which was single focus, and the variable focus. It kills the fat and leaves everything else intact. Here's what the EM electron micrograph looks like. And there's an MRI, or CT scan rather. And here's some of the results of that. You know, we have this, we did a study with them, and it seems to work well on high BMI patients, but I still think Cool Sculpting is more efficacious than this. The Liposonics device is kind of a dud. This is by Salta. It was initially interesting because it was only one treatment. It actually was a little different focus. It was thermal coagulation of the fat. You can see it burned the fat. It worked really well. It really didn't get a lot of consumer report because it hurts like hell. Okay, so really anything that hurts, people aren't going to gravitate towards, even though it was efficacious. So this is pretty much still sold, but I don't know anyone who's bought one of these in the last 5 years. Sculpture is the newest device out there. This is by Cynosure. This is a laser. It's 1060 nanometers, so like sort of similar to the Nd:YAG. It's got cooling on the skin. It cools the skin. It puts the energy into the fat cells. Now remember that fat is susceptible to both hot and cold. Cool Sculpting is the hot. Cool Sculpting is the cold, and this is the hot side of things. It basically burns it, gets to a level where it's getting controlled cell death. So it works pretty well. It penetrates into the fat. The studies were really good. Larry Bass was one of the guys doing some of the initial studies with this, and they were super clean. The tissue responses were good. All the histologies were good. The MRI was excellent. The results are good. But in clinical practice, we don't like it that much. We have one of these. We think it's better on the thinner patients. We found it a little inconsistent use. We still like our Cool Sculpting better. This is another device that I was really hot on a few years ago called the Vanquish device. This is selective RF. Basically, you're heating again to control the fat. I liked it because you didn't touch the patient. You put this over, let's say, their abdomen. It created a nice thermal profile, and the studies were good. But in our hands, it didn't work. We had very bad results with it. That was the initial device. They just gave us a new one to play with, so I don't have any data on the new Vanquish, but I will have some data probably in a couple of months. But we're a little hesitant now because of our bad experiences. And I was super hot on this because I love the concept, but I learned to be a little more careful after that fiasco. But we'll see how the new one comes in place. Everyone should have Kybella in the office, Deoxycholic Acid. This was a company that developed it called Kythera. They got bought by Allergan for like $2 billion. It's an injectable for fat removal. The studies were super clean on this. The FDA-approved place for this is the submental area, and the studies were great, and that's me after Kybella. You swell like crazy after this. I mean, I look like Alfred Hitchcock in the picture with this, so you do get a lot of swelling. But I looked at my pictures. It actually seems to work pretty well. So these are my recommendations for non-surgical fat. I still think if you're going to buy one, you're better off with cryolipolysis. I still think it's the best thing. The problem with it is, though, 1 in 4,000, instead of losing their fat, gains some fat. So you'll see patients in your practice every once in a while that have fat growth from this. If they do have this, you contact the company, you do liposuction on them. I like to use my Vaser or ultrasonic lipo because the fat's a little firmer than normal fat, but it gets off, you get rid of it really well with the ultrasonic lipo. And then Zeltique company will pay for the patients to have their liposuction. So if you see one of these, don't get too stressed, just call the company and they'll deal with it. But that is the problem, 1 in 4,000 does get that. Sculpture, we're still playing with a bit, and I think everyone should have Kybella in their office. I saw Instagram that someone sent me yesterday that somebody was using a dermatologist for Kybella for the arms, and they were just injecting in the arms. I've used this off-label for nasolabial folds. I've used it in every area you're not supposed to. The initial studies showed some nerve injury because I think the dermatologists that were using this didn't have any idea as to nerve anatomy, and they were putting it in the wrong spots. So I think if you stay superficial with it, you can use it off-label on the face in areas where there's superficial nerves. But people are using it for liposuction bumps here and there, and I think it's actually really good to have in your practice for that. So easy to use, easy to learn. So let's kind of switch gears a little bit into the last topic of non-surgical tightening, okay? This is the area that's a lot of hype. There's so many different companies talking about different technologies here and there that it does get a little confusing. But the patients want this. This is data from Real Self. Look at the views on this, 1 million page views looking for non-surgical. Why? Because I know I can get a good result with a facelift, but think of how many patients out there that want a facelift but just don't want to go for it. They don't want to have the surgery, they're afraid of the scars, they may not be medical candidates, or maybe they're ready for a facelift in 5 or 10 years when they're 55, but they're now 45 or so and they want to get something done. So this is where some of these non-surgical technologies come into place. We know that what you do with the face, you reposition and get rid of excess skin. You don't really do anything to the skin quality, and that's where a lot of these devices can work because they can be synergistic. So why should we be interested in this? You can read this, right? It's definitely a facelift alternative for some patients, and I think in the future as things get better, it may put our facelifts out of business. So if we're going to be out of business in 10 years or 20 years from this, don't you think we should be the ones doing this? Look at the way that interventional radiologists have taken over for cardiothoracic surgeons. I want to be at the forefront of this. I don't want to wait until some other specialty, notably dermatology, takes this away from us. That's why I'm involved in this. So here's the mechanisms. Mostly it's through heating. It's from a heat shock protein mechanism. So you have these heat shock proteins. They cause a collagen remodeling response. So I classify these as outside in, things we do outside, or things we do inside the skin. The inside are sort of like lipo cases. The outside are either lasers or pulse light or radio frequency. I'm going to go through a few of those in the next 7 minutes. So external tightening. This has been sort of my favorite thing for the last year or so, fractional radio frequency microneedling. So we all know what microneedling is. You take these little needles like rollers, you roll it on the skin, and it's good for some acne scarring, it's good for some skin rejuvenation. So what the companies have done is they put some energy at the tips of these needles or throughout the whole needles depending on the device. And this puts down a little burn zone histologically in your deeper dermis. So typically with lasers, we're talking about 100 microns, 200 microns. With these devices, we're talking about millimeters. So a typical session for me treating someone's face, I would be at 2 millimeters or 2,000 microns, a second pass at maybe 1,500, and a third pass at 1,000 microns. So we're deep into the reticular dermis with this. There are two different sort of classifications, either energy just at the tip or energy throughout the whole needle. And the histology is a little different depending on which one you use. And there's a few more companies out than I have listed here. This is the insulated needles, meaning that the burn zones are going to be deep unless it's really superficial, which like the 0.5 millimeter, you get a little bit of epidermal injury. This sort of looks like the hybrid laser histology, doesn't it? But you get some tightening with this. And this is the non-insulated needles. Basically, you get like a fractional ablative laser. You're getting a deeper burn zone. So with the non-insulateds, you definitely get some epidermal injury. So in the wrong patient, someone who's a little darker skinned may not be the thing you want to do. So I kind of like the insulated needles. And this is the Invasive system, topical anesthetic or a nerve block, super easy. Usually 3 treatments, a couple of weeks to a month apart. Okay, pretty straightforward, easy to use. Intracell is another company. So what's interesting is both the Lutronic Infinity and the Intracell are both Korean companies. I think there's a little patent infringement, and I hear that the two owners play golf together, so they're not really fighting with each other. But they're very similar technologies. We actually have both, and I really can't tell you which one's better, but they're really similar with a little disposable piece. Syneron Profound is another one. We had this. I really don't like this. It goes in an angle. The needles are a little bit bigger. So I kind of like the other two insulated needles. These are some of the results. You get a little tightening with it. Nothing that impressive, but the NDMed's another company kind of showing you. You get a little red, but they really heal super quick from this. Dr. Clementoni in Italy has done a lot of work with this, with some really good tightening in some of his patients. But note he treats these patients pretty aggressively. But you know, for the pre-facelift crowd, it's pretty good. This is our preferred treatment for acne scarring. I think for acne scars, there's nothing better than microneedling with energy. There's another one. Here's another one within one of the other cases. So this is our treatment for acne scarring. This is a lady that I did a facelift on, and you can see her scars, just the postauricular area, but she had a little bulging in her neck, like a little fold of skin. So I treated her. So it kind of uses for touch-ups of different areas to tighten up some things. So external RF, that's sort of the microneedling component. I have 4 minutes left. So when you look at radio frequency, these are devices that heat up the skin. So they were selling these for cellulite, they were selling it for tightening. I don't know. I kind of like it for post-liposuction smoothing and a little bit of tightening. This is a new device that's just came out recently. It's radio frequency, but it's got unfocused ultrasound built in. So we like this post-lipo. If you do a lot of lipo, you should really look into this stuff. It gets you a lot of smoothing. It gets rid of some of the early scar formation and kind of smooths things out. So that's an external ultrasound device. We all know what Ulthera is. So this is another external device. This is ultrasound based. It puts a burn zone deep down with ultrasound energy, focused ultrasound. Sort of the histology looks like the micro-focused needles, doesn't it? Looks really similar. You image, it then comes down as an ultrasound device. Okay, problem is this device hurts. The results are okay. In my mind, I like the microneedling better than Ulthera. We have this. We do very few Ulthera cases now. We do far more of the microneedling cases. It's way easier. But you get some tightening in younger patients from it. That's the external. I'm going to end with internal tightening. So these are sort of lipo devices. So Barry DiBernardo did most of the early work on this, a good friend of mine, with skin shrinkage and elasticity. So he started with lasers. That's one technology. He measured the temperatures both internally and externally. And we use the Precision. This is the smart lipo device. They have one of their probes called the Precision TX. It's sort of a unidirectional laser probe. Use it in the necks. And the results are pretty good in younger patients. So this is one technology you can use. Now, if you have a smart lipo device, you should use this because it's easy to do. It's done mostly under local anesthesia. And for younger patients who have a little bit of neck laxity and a little bit of fat, it's a nice procedure. That's one of Barry's cases. I tend to use more of the radio frequency now, and we have both the Thermi and the Invasix. Thermi is monopolar, Invasix is bipolar. I was a big Thermi fan for years. I've had it for a while. I was part of the Invasix FDA study in 2010, and it finally got approved recently, so I've been using their newer device now. It's using radio frequency energy inside out to tighten skin. This is the Thermi device, which is monopolar. It basically kills a little fat, heats the skin from the inside out, but you're measuring the skin externally with a thermal camera. Good data on this stuff, really nice papers submitted, and this is actually the body tight or the face tight by Invasix. This is bipolar. So instead of having just a monopolar probe in with an external return, this has the return on the face. What I like about this is it's actually measuring the heat both inside and outside at the same time. It's pretty easy to use. This is one of Barry's cases with the Thermi. This is one of Barry's Thermis. This is my first radio frequency case with a new device on a friend of mine who's 50, had done it under local anesthesia, and she's a month out. I find it a little easier to use than the Thermi. I mean, it takes like 10, 15 minutes. It's a good ROI. So it's a really nice device, and I like the fact that it's very controlled. Barry's been working on breast lifts with the Thermi device, or the monopolar radio frequency device, and that's one of his pictures 3 months later showing a rise. And Diane Duncan's also been working on this with some of the RF devices. So I'm just going to end with this. So my tightening recommendations, I kind of like the microneedles, especially for acne scarring. I like the RF internally. I like some of the RF devices post-lipo, but the problem is if you're going to go buy all these devices, it's very hard to figure out which ones you need in your practice. Start slowly. Most of these things last years and years in your practice. I don't want you to buy any doorstops, and if you have any questions, please feel free to email me or call me. I'll be happy to guide you along with some of the companies. So remember to start with your IPL and then resurfacing cases, and then go from there, and don't be waylaid into buying stupid things that the companies talk you into. Thank you very much.